Assalamu alaikum. I hope all of you are doing well. So, we were studying about the skeletal system, and we are going to continue that lecture today. And about the explanation that I gave of the about the test of diabetes. If any one of you has any questions, you can post it in the group. I'll reply to you, uh, or you can ask me on WeChat and about any questions about the lectures that we are having these days. And I'll try that from next week onwards. I'll try that those live sessions again uh, that we were taking previously. I'll try that for the next from the next week onwards. We do those live sessions again. So let's hope for the best. And please let me know if you are comfortable with these YouTube videos or with those live lectures on the Ding Talk. So I'll be waiting for your reply. Okay, so we studied about three, four types of cells which are present in the bone. There are osteoprogenitor cells, then there are osteoblasts, osteocytes, and osteoclasts. Osteoprogenitor cells are the precursor cells which are derived from the stem cells, and they are actually derived from mesenchyme in the embryo. So the bony material precursor to bony material which would make the bone in embryo is known as mesenchyme, and bone is derived from here. Then osteoprogenitor cells are formed which would mature into the which would then transform into the osteoblasts. These osteoblasts, when they are entrapped in the matrix which they secrete, would become osteocytes, which are mature bone cells. And osteoclasts are macrophages which remove these osteocytes, break down the calcium hydroxyapatite channels matrix, bony matrix that is present in the bone, and then free that calcium that would then go on to circulate in the blood, and that is how the serum calcium level is maintained or is increased. So now we're going to talk about the composition of bony matrix. So in the bone there are different compounds which are present. One third of the bone is made up of organic components, whereas two thirds is made up of inorganic components. Organic components are those which contain calcium as their backbone, such as the cells are organic components, osteocytes, osteoblasts, osteoclast, osteoprogenitor cells. Then there are collagen fibers. There is the ground substance, and inorganic compounds which comprise of two thirds of the total bone mass. They consist of calcium phosphate and hydroxyapatite crystals, which are composed of calcium phosphate and calcium hydroxide. So we can say that bones are made up of meshwork of calcium hydroxyapatite. So this is how the bones are composed, and about 90% of the total calcium in our body is stored in bones in this calcium hydroxyapatite form, calcium phosphate and hydroxyapatite crystals. Now let's look at the microscopic structure of the bone. So if we look at the structure of the bone, it consists of multiple cylindrical structural units which are known as osteons or Haversian canals. So these are Haversian canals or Haversian system, which are also known as osteons. Imagine these osteons as weight-bearing pillars that are arranged parallel to one another along the long axis of a compact bone. So to memorize this, I'll give you an example. If you have to build a building, a big building that is, you must have seen in your university or in your hometown or wherever you live, if you go to a shopping mall or a big hall, all of the weight is distributed upon pillars which are built for the structural integrity, and it may consist of 3, 4, 5 or more floors, but you'll find that those pillars are present at key positions which would hold the structure together, which would uplift the weight of the upper structures, and they would support the upper structures to stay there. Same is the case in the bone. These pillars of osteons are present which would keep the bony structure intact, which would keep the structure of the bone in its place. So as the pillars in the buildings, they are made up of concrete, these structures, osteons, consist of calcium and collagen and cells. So have you ever looked at a structural uh, pillar, that is, if we try to break it down, what is it composed of? It is composed of beams of uh, the steel as well as concrete. The same is the case of bone. The beams are actually made up of collagen fibers which would hold the inner concrete, that is the calcium, in its place. So each osteon consists of a single central canal which is known as Haversian canal, which runs through it. So these are the structures that can be found in the Haversian canal, that is an artery with its capillary network, a vein and a nerve fiber. This runs through whole osteon. And this central canal, central hollow structure, is surrounded by concentric layers of calcified bony matrix. So there are layers upon layers of bony matrix, same as that of an onion. If you peel an onion, you can see there are multiple layers which are concentrically arranged around a central tissue. Same is the case with this. There are multiple layers which are concentrically arranged around this Haversian canal, and these layers are made up of calcium deposits as well as collagen fibers. Haversian canals would allow the passage of blood vessels, lymphatic vessels and nerve fibers. Blood vessels are very, very important for the development of bone. They provide nourishment to the bone and carry away the byproducts. Why are the lymphatic vessels important? As you know, the lymphocytes are part of the blood system, and all of the cells uh, from which the blood is derived, they are known as hematopoietic stem cells. They are present in the bone marrow of the long bones. So this bone marrow produces lymphocytes as well. B lymphocytes, T lymphocytes are components that are present in the lymphatic system mainly. So these are derived from the bone marrow, and these lymphs would carry them to the lymph node to be matured, or to the thymus, or to the B lymphocyte would mature in that bone marrow, and then they would circulate in the lymphatic system and keep our immunity strong. Nerve fibers are there. Uh, so if the bone breaks down, we would have extensive, severe pain in the bone. These pain receptors are also present in the Haversian canal. Each of the concentric matrix tubes that surrounds a Haversian canal is known as a lamella. So this is a lamella, this concentric tube. A layer that covers this canal is known as lamella. There are multiple lamellar layers. All the collagen fibers in a particular lamella would run in a single direction, as you can see in this picture, while collagen fibers in adjacent lamella will run in the opposite direction. This allows bone to better withstand twisting forces. So as you can see, This innermost layer, the collagen fibers are running diagonally towards the right, whereas in the middle layer they are running diagonally towards the left. Then again in upper layer towards the right, and on the layer above it, they would be running left. So this structure continues and provides support to the bone for the twisting. If the bone gets twisted uh, while movement or while any other activity, it would not break due to these structures because they allow these type of movements in the bone. Running perpendicular to the Haversian canals are Volkmann canals. So these are the Haversian canals. This is the Haversian canal. This is the Haversian canal, which is present in between the concentric layers. These are the concentric layers, as you can see, lamellar layers. Concentric means round, whichever thing is arranged in a round fashion, it can be known as concentric. So these are the concentric layers, and this is the central Haversian canal, and perpendicular canals would connect these Haversian canals, which are known as Volkmann canals. So these are Volkmann's canal, and these are Haversian canals. They connect the blood and nerve supply in the periosteum to those in the Haversian canals and the medullary cavity. So this is the outermost layer of the bone that is known as the periosteum. Periosteum would contain these osteons. So what happens here is, this is the bony medulla where the spongy bone is present. Spongy bone is mainly made up of matrix. So what happens here is, these Volkmann canals, it interconnects the periosteal blood supply with the Haversian canal system and the medulla, so that the distribution of the nutrients as well as the proper drainage of the waste products goes on in harmony and it is not affected. So this is how all of the bone works. Now let's look at the microscopic structure of a spongy bone. So in this micropictogram you can see these are the adipocytes which are present here. Osteons would also be like that, arranged in a concentric fashion. Here you can see the osteons, here you can see the lamella. So in the middle the bone marrow is present where the adipocytes are rich. So this was actually the structure of the outer layers of the bone, that is known as the compact bone. Now we are looking at this structure, the inner structure or the spongy bone. So what happens in spongy bone? Spongy bone appears poorly organized compared to the compact bone, and it lacks the osteons. Just a second, if I can see a picture. Okay, I'll post a picture of the osteon in the group later on. Okay, so let's look at pictures of a bone. Okay, so as you can see here, this outer layer is periosteum, then comes the compact bone where the osteons are present, and then comes the spongy bone. Spongy bone is mostly present in the epiphysis area, in the diaphysis it is not so much, as you can see here. Compact bone is thick here in the diaphysis, whereas in metaphysis, epiphysis, the spongy bone layer is thicker. So the compact bone consists of osteons, concentric structures, Haversian canals, Volkmann's canals, whereas if we look at the inner structure, that is the medullary bone or the spongy bone, the spongy part of the bone consists of poorly organized tissues. There are no osteons, and there are a few trabeculae. Trabeculae are a few cell layers thick and contain irregularly arranged lamella and osteocytes interconnected by canaliculi. So there are small channels which are present here, small canaliculi which are present here, and those channels would connect the osteocytes, uh, and osteocytes are arranged in layers of lamella. So here is an osteocyte that is present in lamellar bony matrix. Here you can see the structure. This is the bony matrix. Here you can see the structure. And then there are osteocytes here. The blood supply of the bones, long bones, the blood supply is derived from the nutrient artery, the periosteal arteries, epiphyseal arteries, and metaphyseal arteries. They would supply blood to their corresponding part. Nutrient artery is the main artery. Then there is a periosteal artery that would supply the periosteum. Epiphyseal artery would supply the epiphysis, and metaphyseal arteries would supply the growth plate as well as the diaphysis upper end. Other bones contain different vessels. The vessels which run adjacent to the bones, close to the bones, would supply those bones. Now let's look at a picture. This is the metaphyseal artery that would supply the metaphysis as well as the upper end of the diaphysis. Periosteal artery would supply the periosteum. Nutrient artery is the main artery that would enter through the periosteum at the diaphysis. This is the medullary cavity that would contain large fat cells that are adipocytes, and this constitutes our bone marrow. Now let's talk about cartilage a bit. Cartilage is a connective tissue same as the bone, but it is composed of cells which are known as chondrocytes. In bones, these cells are known as osteocytes, the mature bone cells, whereas mature cartilage cells are known as chondrocytes. And fibers. Fibers can be collagen fibers or elastic fibers, which are embedded in a firm gel-like material that is known as the matrix. This structure, the cartilage, is weaker than the bone in strength, and it is more flexible than the bone. The cells which are present in the cartilage are either chondroblasts or chondrocytes in lacuna. Moreover, these cells can mature into bony osteocytes. Cartilage does not have any blood supply or lymphatics. It depends upon the either adjacent structures, or in case of a joint, the cartilage depends upon the nutrients that are provided by synovial fluid. So cartilage is surrounded by a fibrous membrane that is known as perichondrium. The fibrous membrane that is present in bones is known as periosteum. But the articular cartilage has got no perichondrium, so that regeneration after injury is inadequate. So cartilage at all sites, for example in the nose, in the ear, etc., would contain perichondrium, but the cartilage that makes up joints, that is present in the synovial joints, it does not have any layer of perichondrium. That's why it is prone to injury, and if an injury occurs, it is very slow to regrow, to heal. Cartilage receives its nutrition via diffusion, that is from a higher concentration towards the lower concentration, so the nutrients would flow into cartilage like that. From the capillaries in the perichondrium, hyaline and elastic cartilage can get its nutrients, whereas in case of articular cartilage or fibrocartilage that makes up the synovial joints, it gets its nutritional material from the synovial fluid in articulate disc, and the fibrocartilage gets its supply from the surrounding capillaries. So as I've told you, either from the adjacent capillaries or veins or from the fluid that surrounds that cartilage. When deprived of nutrition, chondrocytes would die and matrix is calcified, and this cartilage would turn into bones by calcification. So chondrocytes, if they are provided no nutrition, they would eventually start to die, deposit calcium, and would transform into a bony tissue. There are three types of cartilage: hyaline cartilage, fibrocartilage, and elastic cartilage. So you can see where the cartilages are present. It is present in the nose, in the external ear, at the cartilaginous joints, in the ribs, in the vertebral discs. The cartilage that is present in the ribs is known as costal cartilage. Then in the pubic symphysis, again in between joints of different bones. Then in the meniscus, menisci are pad-like cartilages in knee joint which would keep the joint in place. Then articular cartilage here in the ankle joint. So all of these tissues, these joints, they contain hyaline cartilage, whereas the vertebra contains fibrocartilage and the ear contains elastic cartilage. Okay, cartilage is also present in the trachea, in the bronchi, in the lungs, and epiglottis is made up of elastic cartilage, same as that of the external ear. So now let's look at a tabulated form table of differences between hyaline, fibro, and elastic cartilage. So hyaline cartilage on gross appearance looks bluish whitish in color, whereas fibrocartilage is densely white and elastic cartilage is yellow on naked eye. About the translucency, the hyaline cartilage is uh, the most elastic of the bunch, kind of sorry, most thin of the bunch, and it is translucent, that is the light passes through it, whereas fibrocartilage and elastic cartilage are quite opaque, the light does not pass through them. So the hyaline cartilage is like glass, the light would pass through it. Then let's talk about the covering. Perichondrium is present in hyaline cartilage at the hyaline cartilage outer side, except free surfaces of the articular cartilage. Then in the fibrocartilage and elastic cartilage there is no perichondrium. The hyaline cartilage is derived from modified areolar connective tissue, whereas fibrocartilage is derived from modified collagenous connective tissue, and elastic cartilage is derived from modified elastic connective tissue. If we talk about the composition, there are numerous cartilaginous cells with some collagenous fibers, elastic fibers, which may be present in hyaline cartilage. Whereas numerous collagenous fibers arranged in bundles with fibroblasts in some chondrocytes between the bundles comprise fibrocartilage, and elastic cartilage is made up of numerous elastic fibers, few fibroblasts, and collagenous fibers in them. Calcification is frequently seen in hyaline cartilage, whereas it never occurs in fibrocartilage, and it is very rare in elastic cartilage. So at what points is these types of cartilages present? Hyaline cartilage is present in the coastal region, articular cartilage of rectocartilaginous bones, epiphyseal cartilage, tracheobronchial cartilage, thyroid cartilage, cricoid and parts of arytenoid cartilage, nasal septum and lateral wall of the nose. Whereas fibrocartilage is present in the intervertebral discs, articular cartilage of the intramembranous bone, glenoid and acetabular labrum, menisci of knee and acromioclavicular joint. So wherever there are weight-bearing joints, there would be fibrocartilage present. Whereas in auricle, epiglottis, auditory tube, cuneiform and uh, corniculate cartilage of larynx is elastic cartilage in origin. This is hyaline cartilage, this is perichondrium. This is the fibrous cartilage. Let's look at some diseases, applied anatomy. Periosteum is very sensitive to tension or tearing, so fractures, tumors and infections of the bone are very painful because the nerve supply is very rich. Fracture is known as a break in the continuity of the bone. And then there is a disease which is known as rickets. Rickets is deficiency of vitamin D, calcification of cartilage fails and ossification of growth zone is disturbed. Growing bones are affected, mineralization does not take place, and multiple bony deformities can occur in vitamin D deficiency. Okay, Vijay, I think you get the point. So we finish the skeletal system, we'll start a new system tomorrow, inshallah. So take care, stay home, be safe, and take care of your elders too. On that note, I would like to say Allah Hafiz. Inshallah, we'll meet tomorrow, next time. Okay, Allah Hafiz.